Hi everyone, my name is Dr. K. I am a resident in obstetrics and gynecology at the University of Nairobi, and today is the 22nd of May 2020. It's also World Preeclampsia Day, and I want to tell you something small about preeclampsia because it has affected so many women and they have been able to get better, but there are also those cases that get rogue. So we need to know about preeclampsia. So what is preeclampsia? Preeclampsia is a medical condition that occurs in women above 20 weeks in pregnancy that is represented by high blood pressure and other conditions like heart disease, kidney disease, just because of that high blood pressure. So who does it occur in? It can be anybody. Anybody can develop preeclampsia, but there are people who actually are more predisposed to getting preeclampsia as compared to others. For example, if you're obese, you can easily get preeclampsia. If you're very young, let's say below the age of 18 and you're pregnant, you can develop preeclampsia. If your age is above 45 years of age, you can get preeclampsia. If you had preeclampsia the last time you were pregnant, that's also a very high risk that you might develop preeclampsia again. And if you have hypertension even before pregnancy, you can develop preeclampsia. So remember, preeclampsia is when you have high blood pressure and you have other organ disease just because of that high blood pressure. If you have any other medical condition, you can develop preeclampsia as well. So what does it do to your body? So preeclampsia usually affects, because of the very high blood pressure, it can affect anything in your body, from your brain down to your heart, to your stomach, to your lungs, and down to your kidneys. So what happens to your brain? Because of the very high blood pressure, you can develop something called brain edema, pulmonary edema, and then there's something called eclampsia. Someone who's having a convulsion due to their hypertension, and that's a very, very severe case of preeclampsia. In the lungs, you can develop something called pulmonary edema, and that is because now you have high blood pressure, water is now in your lungs, you develop difficulty in breathing. It might look like a pneumonia in pregnancy, but because of your high blood pressure, you can develop that. In your stomach, you'll develop some pains in your abdominal area, around this area, kind of like an hyperacidity, but it's not hyperacidity. It's just because of the hypertension. In your liver might develop something like some congestion in your liver, and therefore you feel that pain that area. And then your kidneys are usually affected by this high blood pressure in a way that they don't clear out the dirt and the water, so you develop too much fluid in your body, and you might have now lower limb edema, now swelling of the lower limbs out of the ordinary. Because yes, sometimes when you're pregnant, you might have some leg swelling, but now this one is progressive, and the whole body can also have swelling in a way that you add weight extremely too much during pregnancy. So these are the things that preeclampsia does to your body, and this is why you need to know about preeclampsia. So why are we so worried about preeclampsia as doctors? Is because of the end result. The end result is causing any issue with your organs, and one of your organs in your body, which we can never forget, is your baby inside there. So it reduces, if you have high blood pressure, the blood flow to the baby also reduces. Your baby might be small in size, might not have enough oxygen, might not have enough of glucose and all the nutrients it requires, and therefore your baby becomes very small, smaller than the right age. Let's say, for example, at a certain gestation, they should be a certain weight, but they are not reaching that weight. That's because of the preeclampsia. And worse still, it may cause fetal death. And that is why preeclampsia is very important. It can cause maternal death or fetal death or both. So we have to manage you very early. Don't be scared if you've had preeclampsia before. If it happens again, we manage it as early as possible. So what do we do with this? We give you some medication to lower your blood pressure. We also give you some medication to reduce the possibility of end organ damage, and one of the worst cases, which I have mentioned before, is the eclampsia, and that is having a fit during pregnancy and you have high blood pressure. That is the worst case scenario, having eclampsia. So we give you some medication for that as well, and then we don't forget the baby. If the baby is at a certain age that they are able to survive out of your body, because the only treatment is delivery for you who's having preeclampsia, especially severe preeclampsia, we have to deliver the baby. But if the baby is likely to survive and is still very small, we give you some medication to help the lungs of that baby mature earlier than usual. So sometimes you deliver your baby very early, or sometimes you might have to terminate a pregnancy just because the hypertension is too much and the only treatment is getting the baby out. So I hope we've learned something about preeclampsia and in pregnancy, and why it is important, and that's why we celebrate this day, 22nd of May 2020. And I wanted all of you who've experienced this to give your stories or give your views, and it would be really nice to encourage someone out there who's watching right now with preeclampsia and tell them that it's possible to get better and it's possible to actually have a live baby. So it doesn't stop you from getting babies, but we start very early with you and we manage you. You will be okay. So from me, Dr. K, I hope you have a nice time. Follow me on Instagram, on YouTube. YouTube is Dr. K, Instagram is K Muthembwa, Facebook it's Karen Muthembwa, and on Twitter as well. And have a nice time.